Good morning, everyone. I am Anisia Espuligan. My seminar topic is Revolutionizing Healthcare, Leveraging the Power of Artificial Intelligence. I'm guided by Sanju Sebastian. This slide shows the contents that I am going to discuss today. It includes introduction, origin of AI, relevance of AI in healthcare, applications, machine learning, CSO CLSTM model, related works, challenges, future, conclusion, and reference. So, moving on to the introduction part. Imagine this, a world where healthcare gets a superhero upgrade, just like Iron Man suit, thanks to AI. So, what is AI? AI is the development of computer systems that involves creation of algorithms, models, etc. That is, it enables computers to mimic human-like intellectual functions, and they can perform tasks that require human intelligence. Human intelligence task includes reasoning, problem solving, making decisions, etc. Um, so next is the origin of the AI. Actually, AI, artificial intelligence, it is a term used to describe the use of computers and technology to simulate intelligent behavior and critical thinking compared to human being. Um, the, the word AI is first coined by John McCarthy. He is a American scientist as the science and engineering of making intelligent machines. So now I'm going to explain the relevance of AI in healthcare. Why AI is important. First point is personalized medicine. Personalized medicine means giving each patient treatment designed just for them. By analyzing their specific information, that is, by considering their particular information or genetic data or medical history, this technology gives that patient a particular treatment for curing his disease. Next is efficiency and cost reduction. By using these technologies and smart systems, we can do things more quickly and by without wasting resources. Thus, we can reduce the cost and it will be more efficient. Next is early detection of the diseases. Early detection of diseases means with the help of these technologies, that is, they are more developed, and with the help of this, we can detect the presence of a disease more fastly, and thereby we can avoid harm. Harm can be avoided, and this helps to treat many conditions. Next is enhanced research and drug discovery. This means scientists use this type of technologies for finding new medicines and treatments, for finding new medicines for treatments. Thus, also we can reduce the harm. Then telemedicine and remote monitoring. This means we can talk to a doctor or nurse over the internet. That is, there is no need for us to go to visit that particular nurse or doctor for explaining our condition. We can do it through the online. So the diagnosis process and all, it makes all the process more easily. Then reducing human error. Reducing human error means we know doctors can make mistakes. They may be unaware of some of the diseases or symptoms or etc. That may lead to patient harm and worsen the medical condition. So using these technologies or AI, um, we can reduce that human error. That is, the diagnosis will be more accurate. Next is continuous learning and improvement. Continuous learning and improvement means these technologies are used for ongoing education and training of healthcare professionals. Then diagnostic accuracy, as I already said, the diseases can be diagnosed more precisely. That is, with the help of these technologies, doctors can predict the disease without errors. Human errors can be reduced and precision and reliability is improved. Then global health challenges. We can consider the case of COVID-19. Through the time of COVID-19, we used several these technologies for making the situation more ease and reduce and the effect can be reduced with proper diagnosis and all. Next is applications. I'm going to explain major applications of artificial intelligence in the field of healthcare. Healthcare. I'm going to explain AI for radiology, medical imaging, wearables, vaccine development, and gene editing. So moving on. First one is radiology. Radiology involves the use of artificial intelligence in the study and interpreting medical images such as X-ray, CT scan, etc. Uh, that is, it is a broader field that encompasses various imaging techniques used in medicine. And the major applications of AI in radiology includes neurological abnormalities, finding or founding neurological any abnormalities, then classification of brain tumors, detection of breast cancer, etc. Next is medical imaging. Medical imaging is actually a subset of radiology. It is a process of imaging the interior parts of the body for clinical analysis and for treatment purposes. Common type of imaging technologies include X-ray, CT scan, MRI, and ultrasound. This figure shows the X-ray images of several parts, especially bones and it is actually X-rays are a medical test that used to use to take pictures of inside of the body such as bones. It uses X-rays, a ray which can pass through our body and create images on the computer. The next image is an MRI scan image. MRI means it is also a medical test that uses magnet or radio waves to take detailed picture of inside of our body. They do not involve any radiations. As in the figure, we can see that we lie still in the tunnel-like machine, and it is painless, and the doctors diagnose various conditions like injuries, tissues, etc. with the body structure. Next is ultrasound images. Ultrasound image means it is a medical test that uses sound waves to create images of inside of the body. The devices that send out sound waves are known as transducer. It is shown here. Then next is a picture of CT scan of the chest showing heart and lungs. CT scan is also another medical test that is used to take detailed picture of inside of our body. It is actually a form. It is actually we take a lot of X-rays and come from the different angles and combine it to form a 3D image of that particular part. Next is wearable biosensor. We all know that wearable biosensors are monitoring devices that continuously monitors the physiological signals of human body in real time. The wearables include smartwatches, shirts, rings, fitness trackers, clothing, etc. Um, the major data that is monitored using wearables are they include biometric data, activity and movements, biochemical data, sleep patterns. Biometric data includes our heart rate, fingerprints, DNA, etc. Then activity and movements includes how many steps we taken or how many calories we burn, etc. Biochemical data means our pressure data or the level of oxygen in our blood, etc. Sleep patterns means how many hours we sleep or our pattern of the sleep is calculated. This figure shows a simple operation of the biosensor or operation of the biosensor when a person with uncomfortability is occurs. Then we can see that a person who he faced with an uncomfortability and the wearables are already attached to his body. When an uncomfortable situation is occurred, a signal is produced and an alert message is given to at the same time an alert message is given to the physician and a secondary assistant care provided through mobile phone or mobile phone, and also the data of that particular uncomfortability is uploaded to a care center server and database. Thus, an alert simply when an uncomfortable situation is occurred, a signal is produced and an alert message is given to the particular person who can help him, and the disease or the situation can be the severity of the situation can be reduced. This figure shows some of the developments. It includes here shows a ring sensor, a smart shot. Next is speeding of discovery. Many of the analytical processes involved in drug development can be made more efficient with machine learning. That is, the machine learning can ease the process or reduce the effect of years of work and hundreds of millions in investment. Drug development mainly includes four stages: identifying target molecules, discover effective drugs, speed up clinical trials, find biomarkers for diagnosis. Already AI has proved these all steps can be successful using AI. Next is improve gene editing. Improve gene editing means scientists use gene editing techniques to make changes in specific genes to treat genetic disorder. That is, if a particular gene is affected by any disease, we can find that particular gene, and by finding out we can remove that particular gene, and can be analyzed, and the disease can be cured. One of the most powerful tool that is used to uh, remove that particular gene is known as is called the CRISPR-Cas9. It acts as a molecular scissor to cut and edit that specific gene. Some ways in which AI improves gene editing includes efficient target selection, data analysis, predicting outcome, speeding up researches. Next is how machines learn to diagnose. Generally, machines diagnose diseases using algorithms. That includes deep learning and machine learning algorithms. Um, this algorithm automates the process and makes it more cost effective and widely accessible to everyone. Accessible means it is available to more people. These algorithms have the ability to learn and recognize patterns in digital data, etc. Um, but a major difference is that these algorithms need a lot of concrete examples, and these examples has to be neatly digitalized in the computer. Using this digitalized data, the algorithms identify that particular pattern or that disease, and make sure or come to a conclusion whether the disease exists or not. These are some examples how machines detect the diseases. Lung cancer and strokes can be detected based on CT scan. Then cardiac death or other heart diseases can be avoided using electrocardiograms and cardiac MRI images. Skin lesions can be classified in using skin images, and the eye diabetic retinopathy, the indications or symbols, symptoms of diabetic retinopathy can be founded from the eye images. Next, I'm going to explain more about machine learning. Machine learning, it is a branch of artificial intelligence and computer science which focuses on the use of data and algorithm to imitate the way that human learn, gradually improving its accuracy. Um, Means machine learning actually already I said that some so many data are digital and neatly digitalized, and using these digitalized data, these algorithm machine learning algorithms, there are so many algorithms. The machine learning algorithms identify that particular disease. Healthcare professionals use the latest machine learning to detect abnormalities and prioritize life threatening cases. This figure shows an ecosystem of machine learning in healthcare. That is, machine learning can be used for various purposes, including clinical practice, clinical research, genomic data, and pharmaceuticals. Clinical practice and clinical research means it can be used for diagnosing diseases and treatment purposes and for future studies. Then pharmaceutical means drug discovery, that is for the preparation of the or finding more drugs to treat for the treatment of diseases. Then now there is a model in machine learning that is used for diagnosis. This model is mainly used for detect or disease diagnosis for heart diseases and diabetics. This is the flowchart of that particular model. The model is known as CSO, CLS, TM model. Uh, then from the figure we can understand that the patient body is provided with the so many variables and all. From using these variables, the patient data is collected and uh, it is pre-processed. Pre-processed means these signals may not be in the form in the format for analysis. So uh, we have to change that particular data to a suitable form for analysis. That particular process is known as pre-processing. Then next the outliner is removed using the I4S method. Outliners means any anomalies or etc. Then parameters are identified using the cross search optimization process. Then the classification is made, that is whether the disease exists or not. Also in this process the performance measures are taken, that is sensitivity, specificity, and accuracy are all measured. Thus, by using this model, we can detect at the end we can detect that whether the disease exists or not. There is a presence of the disease in the body or not. These are the steps. I4S technique. I already mentioned that I4S technique is used for removing outliners. Outliners means any anomalies, or there is a variation in the uh, variations are removed using the process I4S technique. It includes a few steps: select few sample points called subsamples from training data and place them in the root node of a tree. Actually, I4S include I4S is actually like a decision tree. I It consists of I trees. I trees means isolation tree. Every I tree is referred to as a binary. The next point is that the point the attribute and produce a cutting point P from recent node data. At the same time, cutting point is produced from maxima as well as minimum values of certain parameters in recent node data. A hyperplane is emulated from cutting point, while the space of recent node is classified into two subspaces, namely data which is minimum than t in certain attribute and is placed on left child, and the data which is maximum than t and is placed on right child of the present node. These two steps are repeated till the child node reaches a single record. Thus, we can identify that particular anomaly and can be removed and analyzed. Next, these are some of the works that are related to my seminar, my topic, that in healthcare field. First one is a butterfly IQ. IQ is actually a portable ultrasound device which is used to identify the quality of ultrasound images, making it easier for healthcare professionals to conduct imaging examinations. The image of butterfly IQ technique is given here. Next is a wireless body sensor network. It is actually a network that is used to observe the heart rate and movement of the users whenever they require, even from remote areas. Next is Google's DeepMind. It is actually a subsidiary of the Google developed AI system for healthcare application. I am moving on to the challenges. The main challenges in this field, that is artificial intelligence in Healthcare includes high initial capital requirement, explainability, lack of qualified personnel, regulation and governance, concerns regarding privacy and security, lack of transparency. Future. What about the future? Future means the field of healthcare. We know that the field of healthcare is developing day by day, and also it is a vast field. And AI is also a vast and diverse realm of data, algorithms, analytics, deep learning, neural networks, etc. So AI system might help medical personnel make more precise diagnosis, identify hidden patterns in imaging studies, and predict how patients may react to particular therapies. This could improve treatment plans, reduce clinical errors, improve the accuracy of the diagnosis. So moving on to the conclusion. In conclusion, we can understand that AI improves healthcare by precising the diagnosis and improve the clinical outcomes. The major power, the crucial part of AI's power is that it is the ability to analyze a vast amount of data sets. That is, I already said that a vast amount of data is neatly digitalized in computers, and using these data, the AI predict the presence of that particular disease or not, particular not all diseases. So it examines or analyzes a vast amount of data. It is a very important part in AI's power. So AI is, we can understand that AI is making significant impact on patient care, diagnostics, research, and overall healthcare ecosystem. So this is just the beginning. That is, AI is emerging. These are the references I took for my studies. Thank you for your time and consideration.